Okay. Hi everyone, my name is Sanskruti and welcome to yet another workshop from the Total Diabetes Foundation. And today's workshop is about diabetes and foot care. And we have Dr. Kavitha here. And Doctor, please introduce yourself.
Hello, I'm Kavitha, working at Chellaram Diabetes Institute as pediatrist since 2013. So, in this session, you may ask me anything about diabetic foot, which you want to know about, and I'll be explaining you about all those things. We can start the session.
Yeah. We will quickly get on with our first question, that is diabetes and foot care. How is unmanaged diabetes affecting our foot, or what can it cause to the foot?
Okay. So if you have diabetes for longer duration, say more than 5 years, or if it is uncontrolled, it can affect the nerves and blood flow to the feet. So the nerve problem is called as peripheral neuropathy, where one may lose their sensation to the feet, and many a times trauma, wounds in the feet go unnoticed. They won't recognize at all. So these small problems can lead to major issues and even end up in major surgeries. Secondly, when you have neuropathy, it may lead to certain symptoms which can be painful as well as painless. Symptoms includes like numbness, burning, tingling, prickling, electric shock like sensation. Patient may feel like as if they are walking on a cotton bed. Sometimes they may lose imbalance. Clinically, we can see some kind of deformity on the feet, like clawing of toes. Clawing will be like this, like clawing of
Okay.
toes, and there can be over dryness, discoloration, nail can be brittle, they may not be able to cut even. And this is what the neuropathy related problem is. When it comes to the blood flow related problem is called as peripheral arterial disease. When someone is having peripheral arterial disease, initial stage they may feel some pain in the calf region or arch of the foot or buttock. So when they walk for certain distance, they may experience pain in the calf, and that tend to stop them from walking. So after 2-3 minutes of break, they will walk again, which is called as claudication pain. The distance at which they cover walking is called as claudication distance. Suppose if the patient, initial stage, if the patient is able to walk for a kilometer and they just give a break of 2 minutes, again they will walk. So that is 1 kilometer distance. That is called as claudication distance. So when the disease progresses, the distance will come down. Like now 1 kilometer later it will be like 500 meters. So that means the disease is progressing. Okay, the blockage or blood flow obstruction is increasing. So once these stage they reach, sometimes this may lead to rest pain also. Rest pain in the sense, whenever the patient is in the resting position, that time also they will feel severe pain, so that they can't sleep, they will get up from the bed, and they often keep their legs in the dependent position. So when the patient is having PAD, when the blood flow is affected, suppose you get a wound or injuries, the wound won't heal and can end up in gangrene. Gangrene is complete death of the part. So these are the common types of foot problem occur when you have unmanaged diabetes. Diabetes mainly affect the nerves, which is called as microvascular complication, that is peripheral neuropathy. This is what we can see. And of course, when there is an uncontrolled diabetes, if the wound is there, wound won't heal and can worsen, there can be infections, all those things can happen.
Okay. I wanted to ask you, what are the first symptoms of identifying something related to diabetes or high blood sugar that can cause a foot damage or a nerve damage that can lead to foot damage?
Sometimes it is not necessary that it may show on the feet. The symptoms may not be visible, but if it can happen that patient may get burning sensation, they may have tingling numbness, but it is not necessary. About 50% of the patient remain asymptomatic in diabetes. When they have neuropathy, about 50% will not complain at all because they have numbness. So they feel like they are walking normally, they don't have any problem. About 50% will complain. So that is why it is necessary that if the patient is having diabetes, right from the diagnosis, every year they have to check their feet for neuropathy and vascular problem. In type 1 diabetes, it is after the 5 years of diagnosis. From there, every year they have to check their feet so that the problems can be picked up early.
Okay, great.
Okay.
Another question is that the blood circulation issues in feet. What how the blood circulation? How do you identify if, as you said, there are no symptoms, and we have to do it every year? So in type 2 diabetes, are there any symptoms in that, or nothing in
No,
type 2
in
as
both
well?
cases, the symptoms remain same, but some of them may complain of the problem, some of them may not complain of the problem. It is often the burning and tingling, numbness, what is the takes the patient to the doctor, because they can't
Okay,
sleep due to the neuropathic symptom and all. But as such, like they may have complained, they may not have also. So that's why diagnosis is very important. Your question was what kind of test we need to do? Is that the question?
yeah,
Okay. For neuropathy, you need to do two, three tests, which is called as biothesiometer. Biothesiometer is a test to check whether the patient is able to feel the vibration at the right time. If it is delayed, then it is considered as peripheral neuropathy. And patient is having peripheral neuropathy. There is one test called as monofilament. Monofilament, if the monofilament is a very simple test, wherein we just have to press and see whether the patient is able to feel the touch or there is a intact protective sensation or not. And there is one more test called thermometry, where we check the cold and hot perception, warm, hot perception. If the patient is not able to feel that, that is considered that patient's thermal perception is impaired and patient is at high risk of developing foot problems. Okay, this is what for the neuropathy. And if the patient is having vascular problem, then there is a test called ankle brachial index. So after doing ankle brachial index, we will come to know whether the patient's blood flow is normal or is there any peripheral arterial disease, whether it is mild, moderate, or severe. Okay.
okay. Another question is that what is diabetic foot and what are the symptoms to avoid the diabetic foot?
So there is no such diabetic foot. Actually, it's a short form of diabetic foot problems, in fact. So the
Okay.
problems which I have told you, like neuropathy, vascular problem, diabetic foot ulcers, infection, these all contribute to diabetic foot problems. So it is a short form, in fact.
Okay. Uh, a lot of people talk about amputation damages due to high blood sugars. So, how do you avoid amputation?
See, for amputation, one thing is like prevention is very important. So, as I said, when there is a neuropathy, there is a loss of sensation. So, patient may not feel what is happening on the feet. So, it is recommended that the patient has to check their feet daily. Suppose if they avoid that, suppose a patient is having fungal infection between the toes. So, patient may not check their interdigital space. So, what happens? These fungal infection will worsen and lead to infection. So when it reaches a stage when the infection is at very high, infection has increased, so obviously if we cannot salvage the toe, maybe amputation is the only thing. But these amputation can be prevented if you take care of your feet. You have to take care of your feet.
Okay.
So I think
Yeah.
subsequent question it covers about the foot care aspect, which I will be telling you.
Yeah. We have a question from an audience. It says, is neuropathy reversible, and what could be the treatment for that?
Okay, neuropathy is not reversible, but you can very well maintain it if you follow proper foot care advice, and if you control your sugar levels well, and if you use appropriate footwear, then up to about 85% to 90% you can prevent the foot related problems. And neuropathy is not reversible, and the medicines for neuropathy, there are medicines, but some of the cases it may not give any benefit. Medicines include like pregabalin, duloxetine. If they consult their endocrinologist or diabetologist, they will prescribe these medicines, but it is not necessary that the pain has to come down. In some of the patients pain will come down, but good glucose control is very important. And there are some topical creams also which they can use, which is called as allantoin and dimethicone combinations are there, which can minimize the pain as well. Capsaicin creams are there. So this is what is for the neuropathy, but mainly prevention is what the thing you have to do, that is foot care advice you have to follow. And mainly you need to prevent the foot related issues. Appropriate footwear has to be used, diabetes has to be controlled. If the sugar level is very high, then the symptoms will be there. If the sugar level is controlled, then the symptoms may come down also.
Okay. When we speak about infections like peeling of skin on sole and around the toes or swelling and hardening corn, how do you handle these infections or what
See,
should we do
peeling
to
of
prevent
skin is,
them?
huh?
What should we do to prevent them?
See, peeling of skin can happen because of the dryness. So, dryness, what you can apply is you can apply some moisturizing cream like Nivea, Vaseline. Olive oil would be better. So, if someone is having dry, scaly feet, probably they can wash their feet daily, in fact, twice a day with a normal tap water and soap, mild soap like Dove or Pierce they can use. Wash it thoroughly, dry it, especially between the toes, and then apply moisturizing cream. Nivea Vaseline is also okay, but apply it from below the knee to sole and upper part. Sole also has to be covered, and do not apply between the web spaces, and ask them to stay back for 10 minutes and then put on the socks, so the moisture is retained there. If you don't use the socks, then dryness will be there, and apply for twice a day, night before sleeping and morning after taking bath. So with this, probably the dryness has to go.
Okay,
Okay,
we have
this dryness occurs because there is a, condition called pseudomotor dysfunction. The neuropathy affects the sweat glands. So because of the damage to the sweat glands, the skin tend to be dry. So it is necessary that patient has to apply the emollient to the feet.
okay.
Okay.
Um, yeah, we have another question from the audience. It says that what is bed nail infection?
Nail bed infection.
Okay,
Yeah, so it is
yeah,
basically onychomycosis, or it can be a infection, bacterial infection also. So what kind of infection it is, we need to see. It can be fungal as well as bacterial as well as bacterial, in the sense when there is a toenail infection, like when the edge of the nail go in, which is called as ingrown toenail. When there is an ingrown toenail, it affects the surrounding skin because the nail pierces in. So with that, the infection comes. So the treatment for that is removal of the side nail. In initial stages with antibiotic, it can be managed, but these happens because the nail trimming is not done well. You should not cut the nails closer to the skin or in the shape of the nail. When you cut in the shape of the nail, this nail edge will prick in and can lead to ingrown toenails. Now that onychomycosis is a fungal infection which is common in diabetes patient, especially in neuropathy. So there are treatment for that, but it tend to recur. So it's basically you need to just file it, and there are nail lacquers available now like Onilac. So you can apply that, you can ask the patient to apply, but basically you need to just file it and maintain. You can even use a normal nail polish also. Okay.
yeah. Yeah, we will go to another question. When you say about do special foot care, as you said, we need to take care of our feet. What all is included in taking care of your feet, or how should one take care of their feet?
Okay, so firstly, ask the patient to daily check their feet for any problems like calluses, corns, fungal infection between toes, over dryness, discoloration. Is there any temperature difference between the feet? If one is too hot or one is too cold, hot means warmer, means there may be infection or there can be chances of fractures. If it is a low temperature, then it is indication that the patient's vascularity is poor, there is a reduced blood flow. So all these things they have to notice. If anything abnormal, they have to consult immediately their diabetic foot experts or diabetologist or endocrinologist, because we can prevent the problems early at this stage. Okay, if it is beyond like 3 4 days, if they wait, that may lead to sometimes infection. We don't know what is happening on the feet, so that's why it is necessary that they have to examine their feet daily. If anything, they have to consult their doctor immediately. Secondly, never walk barefooted, whether it is indoor or outdoor. Huh? So indoor, if you are using slippers, then instead of slippers, probably you can use slip-on kind of footwear or Crocs kind of footwear. Slippers, when you use, you need a lot of gripping power. So patient tend to hold like this. Especially in neuropathic patient, what happens? They have intrinsic muscle weakness, so they tightly hold, and that lead to clawing of toes. So when there is a clawing of toes, what happens? Your body weight comes on the feet, and it doesn't distribute equally. So wherever the high pressure point is there, the patient may develop the calluses, corns, pain. Calluses is nothing but the thickness of skin. Okay, because of repetitive pressure over that area, that becomes hard. From underneath there can be an ulcer and infection. So that's why avoid toe grip kind of footwear. Instead, slip on or sandal kind of footwear is best. Outdoor, when you use, if you use sandal would be better, or shoes with a wider toe box, and it should have an extra depth in a normal case. If the patient is having neuropathy, then we recommend use an insole made up of microcellular rubber or polymer, sandals or shoes. Okay, if there is a structural deformity, if there is a shape change, or if there is a charcot foot is nothing but the dislocation and subluxation of bones. So the foot shape changes completely, and there is like rocker bottom kind of appearance. In that case, the patient has to use molded footwear. Molded footwear is made up of, properly they take the cast, and based on that they make the insole and give to you. So that molded footwear is recommended for the charcot foot patients. Footwear part I have covered. So patient is asked to use socks always, because it will avoid the frictional forces between foot and footwear, which is also a reason for foot problem. And never soak the feet in warm, hot, even too cold water, because we don't know what is happening. And if the patient is having neuropathy, patient will definitely end up into thermal injury, then again infection and all. And next thing is, when you ask the patient to trim the nails, ask them to should not trim closer to the skin, just leave little place and cut straight. And it should not be in the shape of the nail. When you cut in the shape of the nail, the nails will prick in and can lead to ingrown toenails. Okay, and massaging in any kind is not advisable with, especially with counter irritant ointments like Moo, Gendobalm, Vicks, because it may lead to chemical injury. Many patients presented to us with a cellulitis after using Gendobalm and all. So that can be avoided. This vibration machine, which is used on the foot, that also should be avoided. You can see in airports and all, vibrator machines patient tend to use, and they also come to us with problem after using that. Such kind of problem should be avoided. If there is a dryness, apply the moisturizing cream, as I said already. So this much if they take care, problems can be prevented up to some extent.
Okay.
Mainly
Uh,
footwear, diabetes
yeah.
control.
Okay. I want to ask you, is it okay to get pedicures then?
Pedicure, if you have no neuropathy, your diabetes is under control, then you can do the pedicure, but avoid warm, hot soakage. That can
Okay.
be avoided, and avoid peeling of the skin. Most of the salon, what they do, they just remove the skin, all those things, and they just cut the cuticle. So all these things are not recommended. Simple pedicure is fine. You can just soak for 5 to 10 minutes, and with pumice stone, the pores is there. Now that stone can be used, but not the metallic one. Okay, that can be used. And ensure that the nails should not be cut closer to the skin. Whatever the salon, the stylish way of doing should be avoided. Okay.
Okay. Yeah. Uh, do diabetics need special footwear?
Yes, of course. What I said earlier, they need appropriate footwear. Like as I said, it should be sandal kind of footwear. If they prefer shoes, it should be wider toe boxed with an extra depth. If the patient is having neuropathy, they should use footwear made up of microcellular rubber, polymer, which is in the form of sandal. If they prefer shoes recommendation I told you already, it should be wider toe boxed and should have an extra depth, and they get the insole done for that. Okay, this kind of
Uh,
footwears are advisable, and the patient who go to temples or mosque or religious places, there is a insole made socks. The socks has an insole of microcellular rubber that can be used.
okay. So, if the sugars are under control and the patient does not have any neuropathy, Still, a patient would need a special kind of footwear to take care or prevent
No,
any of the
normal kind
injuries.
of footwear is fine, but that should be in the form of sandal and shoes. Maybe Dr. Shaw's, Hash Puppies has a good variety footwear. The sole is also softer. So that kind of footwears can be used. But avoid toe grip footwear, slippers, tight toe box shoes, narrow shoes. Many of them use high heeled footwear. So that all should be avoided.
Yeah, my next question was on that longer duration of wearing heels or socks and shoes. Like when someone goes for trekking, it's like a long hours of wearing shoes and socks. So what can that do for your feet?
So long trekking you can do, that is what the comfortable shoes you have to use. It should not be tight. Even we have got some patient who went for trekking and they had blisters and they had a shoe bite. So in that case, because it's a long duration, so in between you may have to open up your shoes and check whether there is any injury, redness, tightness, because long duration can lead to even fungus also. So that all you have to keep in mind. Put two socks also, that's not an issue, but comfortable it should not be too
Okay.
loose and too tight also, it should be firm.
And what are the effects of wearing heels for longer duration?
You may get heel pain, you may get plantar fasciitis, sometimes it may lead to injuries as well. If the patient is having neuropathy, definitely they should not use high heel footwear at all. That can lead to even microfractures as well. Sprains can lead to problems.
Yeah. Okay. Uh, Someone is asking, do you recommend any footwear or can we jog, walk or run and what are the footwear you recommend? So we already
Sports
talked
shoes
about,
can be used. Sports shoes can be used if you are having diabetes only but no neuropathy. Like as I said, it should be comfortable one. This applies to everything. Whatever you do, it should be comfortable. But in diabetes patient with neuropathy, there is a restriction. Long running is not advisable. So best exercise for the neuropathic patient is like walking. Walking is fine, but you can walk as long as you can, but ensure that it should not be a brisk walk. You have to give 10, after every 10 minutes, give a break of 2 3 minutes. Swimming, rowing, cycling is a best exercise for neuropathic patients. The rest of the thing you can do, treadmill should be done with cautiously, because there are chances of sprain, fractures, especially when there is a neuropathic patient we don't advise at all. Okay.
okay, yeah. Uh, we will get some more audience questions. Is there any muscle loss in the legs of diabetes? And what is the remedy for this? This is one of our audience questions.
Okay, there can be muscle wasting when you have neuropathy. So that is a part of neuropathy, and that also we cannot do anything. If you have diabetes, म्हणजे uncontrolled diabetes, that also leads to weight loss. Obviously, whole body, but it will be apparent in the feet too, feet or leg too. But in patients with neuropathy, there can be muscle wasting. So we cannot do anything, but we have to improve with exercises and whatever recommendation your diabetologist or endocrinologist give, you have to follow accordingly.
Okay. Yeah. The next question is we talked about the signs of diabetic neuropathy. Is burning sensation after a long day common for diabetics or is it early onset of diabetic neuropathy?
No, it can be seen in uncontrolled diabetes patients also. When you have neuropathy, then also it is visible. If you have B12 deficiency, then also it is visible, because there are a lot of many kind of neuropathy. We need to see whether which kind of neuropathy is. But mainly in diabetes patient, it will be distal symmetrical polyneuropathy, which is diabetic peripheral neuropathy. So first we need to see whether the sugar is controlled or not. Despite of the controlled sugars, then you have such kind of symptom, then that could be due to the peripheral neuropathy. So these symptoms can be managed with, as I said earlier, can give some pills like pregabalin, duloxetine, gabapin, all those things can be given. When they consult their doctor, they will decide which medicines they have to put on. And if they are not feeling better with all these pills, then they can also do a therapy called anodyne therapy. Anodyne therapy is nothing but a light therapy, infrared rays. So there will be certain pads which has LED bulbs which can be kept on the sole and upper part of the leg, that is medial and lateral calf. So the patient has to just lie down for 20 minutes. So what is the theory behind it is it helps in opening up the micro vessels which tend to release nitric oxide, which act on the pain receptor. In that way, it will increase the microcirculation on the feet. That way, the pain will come down. But we are also not sure how much percentage it will benefit to the patient. But obviously, there are some good results for that.
Yeah.
Okay.
I wanted to ask you about varicose veins. What are the symptoms of it and what actually it is?
Actually, varicose vein is not related to diabetic foot problem. It can occur in any patient. This is not a part of diabetes management, of course. But in patients with diabetes, we see varicose vein. Varicose vein can be like a thickening of the veins, and it is visible when the patient come, it is visible like greenish in color. And in patient with long standing varicose vein, they may have blackish discoloration on the leg, and there may be ulcer on the medial aspect of the leg, which is typical venous ulcer. So this in combination with diabetes, sometimes the healing may be delayed. In that stage, crepe bandage, regular dressing is what is advisable. But mainly varicose vein is dealt by a general surgery or vascular surgery.
Okay. So I want to ask you about shoe bite. So if you have unmanaged sugars and if you get a shoe bite, how do you deal with that?
See, unmanaged and shoe bite is two different thing. Unmanaged can lead to problems, but shoe
Yeah.
bite has no direct role with unmanaged sugar. But if there is a shoe bite when there is no healing because of uncontrolled diabetes, can worsen that. That can happen. But shoe bite, what happen? Na? You should not use ill-fitting footwear. Then only the shoe bite happen. And when you get a new footwear, what I advise is you have to put on the shoe and sit for 2 days, maybe morning for 20-30 minutes, afternoon, evening, like that. 2 days with socks on, you have to sit for 2 days. Next 2 days the patient can stand for 5 to 10 minutes, and the next 2 days they can walk for about 4 to 5 steps. Then they can gradually increase. Within 10 to 15 days the footwear and foot suits, then you won't get any shoe bite and all.
Okay. We
So
will focus. Yeah.
gradually, the patient has to use the shoes. Should not walk with a new footwear immediately.
Yeah. Correct. Um, we have some questions from the audience. I'll just check. Yeah, what are the effects of wrong nail trimming? We talked about how the nail can go inside the skin.
Sorry, repeat it.
Someone is asking what are the effects of wrong nail trimming?
So that can lead to ingrown toenail in diabetes patient, especially with neuropathy. Sometimes skin and nail grow together. So if you just trim or if you cut the nails closer to the skin, you are cutting the skin also. So that starts bleeding. Bleeding again can be a starting of the infection too. The when you cut the skin, definitely sometimes if there is a low vascularity, the wound may not heal. Even we have one patient who just trimmed their nails and the distal part turned into gangrene. Patient was not knowing that the patient had a PAD too. So that part we had to amputate as well. So you should be very careful while trimming the nails. Just leave little place and cut straight. If you cut inward, then that nail, you are giving a way to the nail to grow inside the skin. So that's why it is not allowed, not recommended to cut inward. Instead, you can just leave little place and cut straight. That would be fine. The sharp edges can be filed. Best method is nail filing after taking bath when the nails are soft from the top and from the side. If you can file, you won't have any problem at all. Probably you can do every 2 days, probably you can do the filing. If the nail are brittle, please do not attempt to cut. You can seek help from the medical professional, like we can also trim, or you can go to the surgeon who can help you out in trimming.
Okay. Yeah, this question was from your long-term patient, Mr. Ravindra sir. Yeah, he's been watching. Thank you so much for the question. Yeah, another question is what is the ideal range for vibration felt on feet? I think this
I
is related to the neuropathy.
Sorry.
Ideal, what is the ideal range for vibration felt on feet?
Within 15 volt, you have to feel the vibration. Generally, a normal individual will respond at 3 4 volt itself, but there is an upper limit of 15 volt. Within 15, you have to feel, which is considered to be normal.
Okay, yeah. I
About
would ask,
25 is severe neuropathy. About 25 is severe neuropathy.
okay. Uh, I would ask if anyone else has any questions from our audience. Please post it on the comment section. Yeah, what is the biggest cause of amputation? This is another question that we got.
Biggest cause of amputation. It can be non-healing wound, infection, uncontrolled infection can be the cause of amputation.
Yeah. Yesterday we had the meet and we were talking about gangrene and reversible gangrene. Someone had a very bad gangrene that the whole calf was green and very
Uh,
weird, but then it got reversed. So, can you talk about
So
a
it may not
reversal
be
of
gangrene.
gangrene?
If it is
Okay.
gangrene, then it is not. Gangrene is complete death of the part, which is not reversible. But if you have, like someone has gone to some procedure like angioplasty and all, so they may, some of the, if blockages may go here and there, that leads to some kind of discoloration in the feet, which can be subsided later, but the distal part may be like that only, but gangrene is not reversible. Once it is happened, but it should not spread further. That is what we need to see. There is a dry gangrene as well as wet gangrene. Wet gangrene is because of the infection. In infection, what happens, you have to remove the infection or try to consolidate that at one side, like demarcation. You need to wait, so you need to do proper dressing. IV antibiotics should be started, and the patient has to be in the offloading position when the feet has to be offloaded. And once the gangrene is there, you cannot do anything except that has to be
Yeah.
amputated, or auto amputation is a procedure where we wait till it falls off automatically with the regular
Okay.
dressing.
Okay. Uh, Someone has asked us what is peripheral neuropathy. Can you talk about?
Peripheral
Yeah.
neuropathy I already covered. Peripheral neuropathy is a damage to the nerves leading due to long-standing diabetes or uncontrolled diabetes.
Yeah. Uh, yeah, we covered neuropathy and what are the symptoms of neuropathy in the start of the session. Uh, do we have any other questions? Anyone from the audience, if you have any questions, please let us know. Yeah, so someone has asked, what are the foot exercises that you recommend?
That also I told. Maybe walking is fine, but be cautious. Use appropriate footwear, and if you want to walk, you can walk, but brisk walking should be avoided. Every 10 minutes, just give a break of 2 minutes. Swimming, rowing, cycling is the best exercise for the foot.
Okay. Uh, any advice that you can give to active athletes or runners, how to avoid blisters or what else can they do to take care of their feet
Same
who
thing,
have
you have to use
diabetes?
appropriate footwear. Make sure it is not too tight that lead to blisters or shoe bite. Use socks always. Always after trekking or after running, come back and see whether there is any discoloration, whether there is any temperature difference, whether there is any swelling. If you find anything, please consult your doctor immediately. At an early stage, the treatment can be done. If it
Yeah.
is delayed, then that may lead to problems.
Okay. Yeah. Any recommendation on types of socks that can be used?
Cotton socks. Cotton socks would be better, but not the ankle length, but the mid leg level length. Some of them may
Uh,
use like the shape of the foot kind of socks, that also should be avoided, because sometimes what happens when you walk, the pressure may create between the toes that lead to problems. So use normal socks. Cotton socks would be better, but one thing is, when you get a new socks, you have an elastic on the upper part. So every three, because in diabetes there can be dependent edema in the evening. Okay, so the foot size tend to expand, so in that case there may be swelling can be there. So what happens, the blood flow, there can be blood flow issue. So this socks leads to tightening. So every three layer of elastic, you need to cut one elastic. That would be the, to make it comfortable, in fact.
okay. Someone has asked, it is advisable to play badminton with mild neuropathy.
You can, but ensure that, because there is a lot of dorsiflexion and plantar flexion, so you should not sprain your feet. That's it. But can, you can do it with an
Badminton
appropriate shoes. Yeah.
and tennis as well, right?
Yeah, tennis is not an issue, that not much movement, no, but badminton there can be some movement. So ensure that you should not jump, you should not like be on the toes. All those things should be ensured, but you can do with care
Yes.
and appropriate shoes.
How often should one check their feet? Every day, once a week, or once a month?
Check fit daily, in fact twice a day.
Oh, okay.
You see your face daily in such a way, you have to care about the feet also. How much care you give to your face, that much care you have to give on the feet also.
Okay. I've got a question that when a long time back when I woke up, I had a very painful heel, like only on my heel. It was very painful, but there was no discoloration, no swelling, nothing. So was it due to something related to my high sugars or something related to diabetes, or it just happens sometimes for a normal person as well?
Don't know what can be the cause, but one common cause could be plantar fasciitis. You know, if you use ill-fitting shoes or ill-fitting footwear or high-heel footwear, or you had a lot of activity, so sometimes the heel can pain. The pain is like when you walk for initially when you get up from the bed in the morning, you feel severe pain. So when you, as you walk, maybe probably 10-20 steps, you will feel better, and later the pain disappears. So it starts with the initial step of walking and then disappears, which is called as plantar fasciitis. So for that, or you may have heel spur also. For that, you need to do some exercises as well as use appropriate footwear to prevent that. Softer footwear is recommended.
Okay. Thank you so much. Last call for any questions that our audience want to ask. Um, Neuropathy related question. We have answered a lot of neuropathy related questions during the start of the session. Um, yeah, how
And,
to get rid
oh,
of cons as well. I think we have talked about how to get rid of cons. Do you want to share some light on how to get rid of cons?
okay, cons again, it is common. So use you have to clean your feet properly. I mean, if there is a dirt, don't walk barefooted. If you go by poolside, then also you get cons. If you go to saloon also, because the cleanliness is must for that. So there also it can cons can develop. And if you use someone's footwear, use your footwear, don't change the footwears, then also it can lead to con. Or if there is a pressure point, continuous pressure of, or there is a history of thorn prick, then also you can have a con. So initial stages of con can be prevented by proper application of moisturizing cream, as I said, Nivea, Vaseline, or olive oil. If it is too deep, then definitely we may have to remove it, or you can apply some topical local application. When you consult your surgeon, they will prescribe like salicylic acid based creams or lotions that can be applied at the initial stage. Please do not use corn cap, that can lead to maceration of the skin and can lead to infection also. So corn cap, callus cap should be avoided. Okay.
Okay. What is the difference between cons and what? And yeah,
Viral
how
warts. It's another form of con only, but it spreads faster. Viral wart.
and what is the treat like? How does the treatment differ for both?
Same only. Viral wart also you can use this. Sometimes the dermatologist will burn that and give, cauterize that and give. So the treatment is almost same only. But in viral wart, it sometimes spreads faster to other part of the feet also.
Okay. And are there any measures to avoid it, the viral
Cons.
wart? Yeah,
Viral
viral
wart
wart
probably
and cons.
see cons, as I said, neatness is important.
Yeah.
Sometimes it may not be preventable also. Viral wart probably the question will be best answered by the dermatologist. It is their field, so they will be you can ask them.
Okay. Yeah. Yeah. This was a great session learning about feet and neuropathy a lot. I'll ask someone if we have another question.
One question I
Yeah.
can see is someone once told me to reduce protein intake in case of varicose vein.
Yeah.
Is it true? Sorry, I'm not sure. Varicose veins doesn't come in our section, so I'm not sure.
Okay. Puneet, sorry for that. Yeah, I think this was a great session learning about foot and please take care of your feet. It's very important. Gangrene can happen. Unbalanced sugar, high sugars can lead to your foot damage and unreversible neuropathy. Yeah, with that, I would like to conclude our session. Thank you so much, Dr. Kavita, for joining us for today's session and shining the light on foot care and what are the symptoms and what we can do to take care of our feet. Thank you so much. Are there any last comments that you would like to tell us and shine the light on?
Yeah, that's it. Only thing diabetes should be controlled. Keep checking regularly, at least once a year, for neuropathy and vascular problems. If there is a neuropathy, established neuropathy, then the duration will come down like once in 6 months because a patient is at risk of developing foot problems. So keep visiting your foot expert to prevent the foot related problem and use appropriate footwear. That is what is important. If you follow these 3 points, then you are on the safer hand.
Yeah.
Okay.
Thank you so much for everyone who joined us, and thank you so much for the questions. This was a great session. I would like to take your leave, and thank you so much for joining me, Dr. Kavita.
Thank you, Sanskruti. Nice to
Bye,
meet you.
everyone. Nice to
Bye.
meet you too.